I always like to start with the person receiving safety net benefits. So normally we're talking about like a single mom with a couple kids who's just down on her luck for whatever reason. She lost a job and she's turning to the government saying, hey, I need some help. And so what we really think about is, okay, let's think about from her perspective. She's going to one office to get food stamps. She's going to another office to hopefully get housing. She's going to a third office to get childcare, maybe even a fourth office for health benefits so her kids can see a doctor. All of that is going to be a separate IT system, a separate eligibility check, separate caseworker. That's 4 offices that she's already dealing with. She's probably taking a bus to each of those. And then she's on the benefits. That's great. She's able to like provide for her and her kids' basic needs. And the question really comes, what next? How does she get out of this situation she's in? How does she get back into the workforce? Now, the government, the federal government, state government, North Carolina, they have all sorts of workforce benefits, but it's another office. It's usually not even the same city. It's a completely separate system, a separate caseworker who has no contact with any of those previous offices that she's already been to. And so when we're talking about One Door, we're talking about a model where she can get all the safety net help she needs while also the same caseworker who's should be connecting her with, that food stamps, Medicaid, all those things, is also helping her plan longer term. Okay, let's get you some education if you need to finish up your high school degree. Let's get you some training so you can actually make a living wage for you and your kids. So she's constantly pointed to a life of flourishing. And the amazing thing is 49 states in the United States kind of operate on the first model I talked about. The second model, where we're talking about One Door to Work, that really only exists in one state. It exists in Utah, and it's been on the ground for 30 years. So we're talking about a transformation of our safety net to be directed towards flourishing. That's what One Door is.
Okay, very good. So in North Carolina, then, our current system, how does it work? What improvements should be made? I mean, you just mentioned only one state is actually doing this.
Yes.
So what's it like in North Carolina?
So in North Carolina, I think you have 100 counties. So you have 100 Department of Health and Human Services offices or Department of Social Services offices. And if you live in a county, you're going to go to that DSS for your food stamps and your Medicaid. It's probably a separate office for your housing. That's it's federally administered. And you have 24 local workforce boards. They overlap with 100 counties, but you're going to have to find a separate caseworker for if you're trying to get into workforce services. That's kind of how it functions in North Carolina.
Okay, great. Talk about Utah some, if you would. How's it work there? It's since the 90s, I think you said it's been there. So what's that?
So Utah kind of noticed this in the 90s. They're like, our system just doesn't make a lot of sense. They started out with an audit in 1992, and the audit revealed we have 23 different programs across 6 different departments, and none of these departments are talking to each other. So Governor Leavitt down there in 1994, 1995, he established a task force, and he assigned a task force saying, I want all of my safety net programs, I want all of my workforce programs, I want them in one department. If they're serving the same person, that person should only interact with one department. And by 1997, he launched the Department of Workforce Services, and it was named that very explicitly. It wasn't the Department of Social Services, it wasn't the Department of Health, it was the Department of Workforce Services, because that is the end that they're trying to push people towards. Because we know that work is the way out of poverty. We obviously want to meet someone when they're in a rough time, get them the services. We don't want them to go through hardship. But the goal is to get them to that workforce. So that's kind of how Utah functioned.
So what does One Door mean for those who are kind of currently on the system? So a lot of times the current system it kind of traps you.
Yeah.
Instead of giving you a baseline to start at, and then you can move up from there. So how does One Door help those who are currently in the system?
Yeah, I think a lot of people don't know how many programs we're talking about. Like I usually analyze federal programs. I've counted 105 means tested safety net programs. And that spans from cash benefits to food assistance, medical assistance, education assistance, workforce. But that's all 105 different programs across probably 12 different federal agencies. And it gets even more complicated when you get down to the state level. States are responding to federal incentives here. So when we're talking about someone who's trapped in that's a lot of safety net assistance that they're getting too. That single mom with 2 kids, she might be getting somewhere between 50 and 70 grand a year in safety net benefits. And that sounds like a lot, and it is a lot. It's enough to kind of get you above subsistence in America, but it can also act as a trap. So finding a job and getting education and training to work yourself out of that kind of assistance can be a daunting task, and it can almost be easier to just sit on the sidelines. But we know that the outcomes for that woman, her children, long term, if she doesn't start that pathway back into work, back into education, her long-term mental health declines, her physical health declines, her children's educational outcomes, they all decline. They all do terribly. This is when we start to see the cycle of intergenerational poverty really take place and take hold in that family. So if we don't break out of that cycle by creating a one-door model where she comes in and a caseworker carefully assesses what's going on, is there domestic violence? Did you not get the training you need? And then sets her on a path to break out, they don't break out.
Gotcha. Okay. What are so in the states right now, also in the federal government, what are the biggest roadblocks to implementing one door in the states?
Yeah, so some of it is just like states taking on this task. We're going to really analyze what's going on in our state, and we're going to restructure everything in our state to be work focused. But that's only part of the problem. When we really looked at what happened with the Utah story, we're like, why didn't other states just do what Utah is doing? And one of the parts of the story we learned is that in 1998, Congress looked at what's happening in workforce, and they imposed a partial solution. They passed something called the Workforce Investment Act. And they did something great, which was they said, hey, Utah, you're grandfathered in. You can keep doing what you're doing. And for every other state, they imposed more requirements. They locked in the system that kind of currently exists. So they said, all right, North Carolina, you get your 24 local workforce boards. You can't change it. So in 2017, Maine applied to the federal government. They said, hey, we'd really like a single state solution like Utah has. We really like it to be integrated. And the Department of Labor wrote back in the Trump administration and said, we can't give you that. We don't have the legal authority to give it to you. Now, we started to recognize at a federal level, hey, we got to fix this. So recently in the House, the committee that's in charge of this area passed a bill that would give 4 states the ability to break out of this, to pilot this. It hasn't been passed by the House yet, but there's inklings that we're starting to recognize, let's change this system.
Mm. What are the 4 states?
So they haven't identified them. Okay. They've said they have put some strict boundaries. The committee passed bill put some strict boundaries. They said you have to have a population of less than 6 million. You have to have a labor force participation of less than 60%. North Carolina is just slightly above that. It's like 60 point something. But that doesn't mean it's going to stay that way if it passes the House.
Gotcha.
Yeah.
So is that that's what needs to be done at the federal level currently is?
The federal law has to change is what needs to be done. Yeah.
Okay. All right. So here in North Carolina, what can be done right now? I know there are limited things without federal intervention, I guess, but what could be done?
I think the most important thing is to get a task force up and running where you have, say, if you have 23 different programs, it's probably more in the line of 50 now, across 6 different state departments. You bring those stakeholders into a room and you say, if the program is affecting the same type of person, a low-income person, we need it in one department. We need one IT system. We need one case manager for the person who's coming in the door. And we need one road out of poverty. We need to focus all these folks who are coming in the door on a long-term plan of getting back to work and getting back to sustainable work.
Okay. Are there any other states that currently have a task force in place that are that's passed or?
Yeah, actually 2 I can talk about. So last legislative session in Texas, they passed a task force, which is, I think, up and running now. And they also passed a resolution calling on Congress to change federal law. And just yesterday in Louisiana, the new governor there signed an executive order launching a task force. So you can either do this via legislation or the governor can take the reins and say, I'm just doing this because a lot of this is under the governor's control.
Okay.